Today we're talking about supporting our children's mental health during the coronavirus crisis. So, here's just a short list of things to work on to that end. So, you want to keep routines in place. You want the daily life to have as much structure as possible. So since your regular routines are completely turned upside down, you're going to have to create new ones and stick to them. The more structure there is, the less stress there will be. You need to be creative about new activities and exercise. You'll have to figure out how to do things differently, but it's not too difficult, and you can include your children in the process of working out how these new routines will be, what they will consist of, how they'll be done. You need to manage your own anxiety and take care of yourself. If you're a wreck, you're not going to be able to take care of your children. If you're feeling stressed out, your children are going to sense this, and it's going to make them anxious as well. And the same thing for any other mood problem you have, such as depression or whatever. Do your best, again, to keep yourself healthy in order to keep your children healthy. Limit your consumption of news. So on one hand, you want to be kept informed, but if the cable news is on 24 hours a day, it'll drive you crazy. It'll increase your anxiety and make things difficult. You won't be able to have a structured life because your entire life's going to be consisting of listening or watching the news. So limit it. Stay in touch virtually. You have your telephone, texting. You have Skype, Zoom, Facebook Messenger, FaceTime, etc. Use it. You can't spread the virus that way. You're not touching anyone. So you can maintain your social contact even if you can't maintain your physical contact. Same for your kids. So make plans. It's hard to think ahead when your routine has been totally disrupted and you don't really know for sure what the next day is going to bring. We're in uncharted territory. But there are certain things that you can plan for and include as much as possible the other family members, including the children, in the formulation of these plans. Try to keep it positive. You can always look at things in two ways. The glass is half full, it's half empty. Hey, there are advantages. Okay, maybe you're off from work. That's bad. But hey, you've got time off from work. That's good. It depends on how you look at it. Try to look at the positive side of things as much as possible. Keep kids in the loop, but keep it simple. You don't want to lie to the children. You want to keep them informed, but at their developmental level. If it's more complicated than they can really grasp, you're really not helping them. On the other hand, if you hide things from them, if you aren't truthful with them, and it's only going to end up increasing their anxiety and distrust. Also, you want to check in with the very young children. They may not have a clue as to what the hell's going on, but they are going to see the disruption in the daily routines. It's going to, in some cases, generate anxiety. And you need to talk to them about their feelings and their concerns and support them as much as possible. And again, for yourself, if you're getting overwhelmed or you just need a break, ask for help and accept it. Don't feel too proud about it. If you allow yourself to get overwhelmed by this, you're not going to help anyone. So, where do you go? Who do you call if things get out of hand and you need professional help? Well, you can call your primary care doctor if it isn't an extreme life-threatening emergency. And they may be able to help you with your problem directly via the telephone or telehealth, or there are services available in New Jersey through mental health professionals available to help you with these problems. So I have listed here what to do depending on the acuity of the problem. So if you're having a situation where the person is actively threatening his own life or someone else's life, then you need to handle this immediately. So basically that's a 911 call, or go directly to the emergency room or call the police, etc., whatever is going on there. So that needs to be handled instantly in that way. If it's neither of those situations, but it's still very urgent, you call Perform Care. Their number is 877-652-7624. And their website is at www.performcarenj.org. They will triage your call and refer you to the appropriate provider. And their providers are set up to provide services via telemedicine. So you don't have to worry about the additional anxiety of having to go outside and expose yourself unnecessarily during the outbreak. If the call is more of a routine problem, you're having a problem but it's not extremely urgent, then you would call Ascenda Integrated Health at 856-881-8689. And their website is ascendahealth.org. They also have telemedicine available. So these are the services that are available, not just South Jersey, but it extends up towards Central Jersey as well. So I hope you found the information useful. Stay safe. Thank you.